Welcome, I'm Lauren Schuster, and I'm joined by Dr. McCarthy of the Columbus Regional Hospital. Now, doctor, tell us a little bit about who you are, your specialty, and where you practice.
Sure, my name is McCarthy. I'm a board-certified urologist. My practice is in Leland, North Carolina, and I specialize in robotic surgery.
And now, we know that a lot of your patients, they deal with prostate cancer, correct?
Yes. When you look at Southeastern North Carolina, it has the second highest incidence of prostate cancer in the world, and we see a tremendous amount of prostate cancer, so it's something that we are very familiar with and can take really good care of patients from the initial presentation of something like an elevated PSA, which may mean someone might be at risk for prostate cancer, all the way up to completion of diagnosis and treatment.
And now, why should someone who is battling this disease come see you?
Sure, so for the last 17 years, I've been in this area. I've seen 6,000 prostate cancer patients. I was one of the ones who helped develop the robotics program for several years now. We've performed almost 3,000 robotic surgeries in the area locally. But more importantly, my job is to have a very good relationship and explain things to patients so they fully understand what the disease process is and help them make good decisions.
And now, is this a new technology? I feel like a lot of people don't know a lot about robotics and how it can ultimately help their health down the road.
Yeah, urology is one of the fields that was on the forefront of robotic surgery. When you look at certain specialties where technology really helps them advance the care, urology has always been a big player in that. And robotics, the one everyone thinks of is the intuitive surgical. One has had several advancements over the years. So it allows us, if we are performing surgery on people, to make much more precise movements, decrease blood loss, smaller incisions, and hopefully get people out of the hospital and back to their regular activities quicker. So when you look at the data, somewhere between 1 in 6 and 1 in 8 men will eventually be diagnosed with prostate cancer in their lifetime. And when you look at prostate cancer, I always tell people is it can mean drastically different things to everyone based upon the age of the patient, their health status, other comorbidities that they have, as well as how aggressive the cancer is. And that can vary from someone who can have a very indolent form in which we can watch them very closely, to some people who can have very aggressive forms of the prostate cancer.
And now, what made you realize this is something that this world needed, this advanced technology?
Yeah, so I think like a lot of things, when things are being developed, they're not always meant for that particular thing. Like the robotic stuff was really developed for the Army, and it really wasn't practical to go out and do robotic surgery in the field. And then eventually Intuitive took over and developed it, and urology was just one of the specialties where it really fit into the paradigm of treatment for patients. I've been involved with robotics for about 20 years now, and if you look at when the first robotic surgery was done, I think it was 1998, even the advancements in the type of robots that we use have advanced significantly. I think this is the 6th generation of the new console and machine that I've had a chance to work on.
Mm-hmm. And I feel like when people hear about robotics, people get a little bit nervous because it is the future. But this is going to help everyone's health down the road, and I think you can help people realize that this is a good thing.
Yeah, for sure. Sometimes people think of robotics, they think of that you just go in and a machine does the work. No, this is 100% driven by the surgeon. And so you want to find people that you trust, have done a lot of it and really familiar with the technology, but there are multiple specialties now that are using this technology in the area.
Wow. And now, if someone who is watching this is interested in this and want to contact you, what is the best way to get in to see you and to see how this robotics works? Yeah,
I always think it's very important for people to ask around in the community. Who have they seen? Who do they feel comfortable with? What diagnosis they've had? It's very often that I have patients that come in really because one of their friends, neighbors, family members had dealt with the same process and has seen us and felt very comfortable from the beginning to the end with diagnosis and treatment. And so I think that's very important, is to get people that you trust to help advise you on the type of people that you need to see. And people are always asking, do we see new patients? Yeah, I think the day we stop seeing new patients is the day we don't work anymore, because constantly these diagnoses are coming along, and we need to be there for our patients for hopefully many years to come.
Amazing. And where are you located?
We're in Leland, North Carolina.
Awesome. Well, thank you so much, doctor. Appreciate your time.
Thank you.